Madam Chair, we're now live on YouTube.
Okay. Okay, we are here virtually March 7th at 10 o'clock. Staff, can you please call the roll?
Yes, thank you. Starting roll, Board Chair Grimmer.
Present.
Michelle Kelly.
Present.
Jim Barnes.
Here.
Jennifer McClendon.
Present.
Janelle Woodward.
Present.
Teresa Karsten.
Present.
Laura Rich.
Present.
And Betsy Strasburg is absent today. We do have a quorum. Please remember to state and spell your name before speaking for our transcriber. Thank you.
Okay, thank you. We'll move on to public comment. Public comment will be taken during this agenda item. No action may be taken on any matter raised under this item unless the matter is included on a future agenda as an item on which further action may be taken. Do we have anyone online for public comment?
Yes, we do, Madam Chair. I'm getting the slide up right now. We have about 3. Let me do a preface real quick.
Thanks.
If you would like to call in and provide public comment, please dial 669-900-6833. And when prompted to provide your meeting ID, please enter 847-9144-0625 and then press pound. When prompted for the participant ID, please press pound. Join the Zoom meeting as an attendee for making public comment only. If you do not wish to make a public comment, please leave the meeting now so that you're not accidentally called upon. Please feel free to watch it via the YouTube live stream on the PEB YouTube channel. The link for the live stream is located on the agenda. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you'll have been advised you have been unmuted. Please slowly state and spell your name for the record, and then proceed with your comments. Kent Irvin, please slowly state and spell your name for the record.
Kent Irvin, ERVIN for the Nevada Faculty Alliance. Good morning, Chair Grimmer and members. The Nevada Faculty Alliance opposes AB 22 and SB 32 as introduced. These bills chip away at the independence and authority of the PEB board to act as guardians and fiduciaries of the employee benefits plan. AB 22 removes the authority for the board to decide whether going forward with a vendor contract is in the best interest of the program and participants. SB 32 takes away an accountability reporting structure without providing an alternative. With unknown major changes for PEB coming with the Nevada Health Authority, these separate changes should be set aside. The board was not consulted about these 2 bills despite 2 open meetings since they were made public and before the hearing. Please take a board position in opposition of AB 22 and SB 32 as introduced. Please support Assembly Bill 188, which restores retiree healthcare benefits for state employees who were hired after 2011, including NSHE faculty and staff. Those employees will receive no PEB health benefit subsidy when they retire after the minimum 15 years of service. AB 188 would restore those benefits. Because it is less than 15 years since 2011, the state has saved no money from this elimination of benefits after the Great Recession. Full retiree benefits are needed to recruit and retain high-quality faculty and staff, especially in competition between state employment and city and county employment. PEB has always been a pay-as-you-go plan, so the only potential savings would be in future decades as those employees hired after 2011 start to retire. Retiree health benefits are paid by a fringe rate charged on all state employees' salaries. Since FY 2010, the fringe rate has ranged from 2.15% to 3.18%, or 2.5% on average. For the next 2 years in GovRec, it is 2.59% and 2.50%. Given a balance between state retirees and active employees, that fringe rate should remain stable after passage of AB 188, so there is really no increase in costs. According to PEB's fiscal note on AB 188, the projected increase in the OPEB liability due to AB 188 goes from 1.46 billion to 1.64 billion, and that is modest and small compared with the total state debt. It is unlikely to have any effect on the state's credit rating or bond prices. The OPEB liability is not being paid in advance anyway, and is unlikely to be paid in the future, since it's a pay-as-you-go plan. In the fiscal note, PEB also indicates they need 4 new staff positions to handle the new retirees. We agree PEB likely needs more staff to provide excellent customer service, but AB 188 will not significantly increase the number of retirees. It will only prevent the reduction in retirees with subsidy in coming decades. Please support AB 188. Thank you.
Thank you, Mr. Irvin. Doug Unger, please slowly state and spell your name for the record.
Doug Unger, D-O-U-G-U-N-G-E-R, and I'm the UNLV chapter president of the Nevada Faculty Alliance and a member of the UNLV Employee Benefits Advisory Committee. I'd like to speak to the agenda item about the Nevada Health Authority and to express to the board how incredibly nervous our faculty and staff are about this change. In this particular moment, when Medicaid is under assault, it seems to us very, very nervous-making to move PED into the same executive authority, the new Nevada Health Authority, that puts it adjacent to Medicaid. Also, we have questions about the independence of PEB from Medicaid after this change happens, and I hope the board will really ask Administrator Weeks about just exactly how this transition would work. The quote, bringing the programs together doesn't really provide any comfort at all. What I find in talking to doctors and providers in Southern Nevada, which I do often, is that they are complaining that right now they are underpaid, and for that reason, they're leaving provider networks that accept our PEB insurance. So if Medicaid is going to push their provider payments down, we may have a provider shortage, and it may only increase our provider shortage. So we're very, very uncomfortable with that as well. You know, basically speaking, if we're going to put this horse in the same team that's pulling Medicaid, and Medicaid is a horse that's going to be shot, it's going to be very, very difficult for that one horse to pull the wagon and, you know, do it in a manner that doesn't damage health benefits for public employees. I would also like on the legislative agenda to express also my opposition to SB 32 for the reasons Dr. Irvin outlined. Also AB 22. An addendum to SB 32 is that if it could be amended to actually change the quality control officer of PEB to more of an ombudsperson who advocates for employees and the issues they have with providers, then that would be a big help. And we do support AB 188 that will restore benefits to retirees. Thanks very much for asking the probing questions that are necessary about this major move into the Nevada Health Authority. Thank you.
Thank you. Caller with the last 4 digits, 0891. Please press *6 to unmute your phone if you wish to make public comment. And please slowly state and spell your name for the record.
Yes, thank you. Good morning, Executive Officer Glover, Chair Grimmer, and fellow board members and staff. My name for the record is Terry Laird, T-E-R-R-I-L-A-I-R-D. I'm the Executive Director at RPEN, Retired Public Employees of Nevada. We were founded nearly 50 years ago, and our mission remains the same today as it was then, the protection of healthcare benefits and a PERS pension earned by all public employees. Looking through the information shared today about a proposed Nevada Health Authority of which PEB is expected to join, it would seem like a good idea as outlined on page 6 of the document, bringing these programs, PEB, Medicaid, and the Silver State Insurance Exchange, together to align quality of care and lower healthcare costs. Who could argue with that? However, there have been so many changes at PEB since 1999. Our concern is the integrity of PEB as we know it for actors and retirees who faced a lot of change since being moved out of PEB and into a Medicare exchange. Our PEN would also not be in favor of massive changes that could possibly occur with something new. As Mr. Irvin and Mr. Unger said, we also oppose Assembly Bill 22 and SB 32. However, we do also urge support of Assembly Bill 188 for all the reasons mentioned previously. But no matter, we do very much appreciate the assistance PEB has offered our members. We hope it will continue should a health authority come to fruition. I'd also like to remind you that our PEN does mail a bi-monthly newsletter to all of our members featuring a column called Health Matters from PEB and Money Matters from PERS in every issue. I realize Executive Officer Glover is quite busy, especially now due to the legislative session, but it would be great if one person at PEB could be assigned to provide us with a regular column to feature issues important to all PEB participants. Thank you very much.
Thank you. Madam Chair, that is all for public comment.
Okay, thank you. We will close agenda item number 2 and move on to agenda item number 3. Discussion and possible action regarding 2025 legislative bills that may impact the Public Employees Benefits Program as directed in the attached bill tracking table. Celestina Glover for possible action.
Good morning. This is Celestina Glover, Executive Officer for Public Employees Benefits Program. The table before you, for those of you who have it open up, is a list of some of the bills that we're tracking. We've got over 200 on our list, but this is the first 40 where we have either seen them being introduced, the BDRs have bill numbers, and possibly we have added fiscal notes per the request of LCB. Of those bills, 2 of them are PEB bills, AB 22 and SB 32. AB 22 actually changes the process of the contract awards. It is not intended to take away authority of the board. What it's trying to do is streamline the process. So we're asking that we update our statute so that we would follow 333 like other state agencies do. That does not stop us from bringing the request for the RFP to the board in the first place. We would continue to do that. We would continue to provide status updates on contracts, so where we are, what's coming up on expiration, where we need to go, any new programs, things of that nature. In addition, the current statute says that we may have a board member as a member of the evaluation committee. We are changing that language to say we shall have a board member, at least one. Obviously, we can have more than one, and that is how the board keeps involved in the contracting process. We typically try to get 2 or more members to participate in the evaluation committee. So with that, just the way our process works right now, sometimes this can extend our ability to get a contract, especially if negotiations go long, if there's delay because of people's schedules, getting meetings scheduled, especially during a legislative session where it's harder to get everybody together for the one-off meetings. We've suggested this language when the governor came to us and said, we would like to know how you can streamline your processes to meet his goals. And that is one of the bills that we submitted. The other is SB 32, which essentially puts the QC officer under the executive officer for the program. When that position was first created, it took on more of an auditor function. Over the years, that has changed. They don't perform audits in the way that it was first envisioned. What they do is that the person in that position essentially provides education, communication, assistance, as was mentioned, more of an ombudsperson function rather than a quality control officer. That is what we're proposing to continue with, is that person would continue in doing those functions. We've gone so far as to include the education officer in the quality control unit so that they can work together to address our members' concerns. We don't, in the past, when they were an auditor, the concern was that we needed to keep a separation between the QC officer and the executive officer, but with the change in function, that isn't the same concern as it may have been in the past. In addition, we have several other audit functions that PEB goes through. We are probably more audited than most state agencies because we have an annual financial audit. Our financial statement is included in the state's financial statement and is shared with the board and is posted on our website once those final audits are completed. Our vendors, many of them have quarterly audits or annual audits to ensure that those vendors are doing what they need to do. We also have a biennial compliance review to ensure that we're following state and federal law as far as our plans are concerned. So the audit function itself is covered. Keeping the QC officer reporting to the director of the Department of Administration really doesn't provide any particular safety measure or further assistance to the QC officer and the function that they do now. So that was the reason we submitted that bill. The rest of the bills on this list, depending on whether they actually get approved, will have some effect on how the plan does business. So it could be that we have to change some regulations, we may have to change master plan documents, or there may be a cost to the plan. Based on the fiscal notes we have listed on the document right now, if every single bill was passed, which we know they all won't get passed, or they'll get amended and it'll change the fiscal note. But right now, with just these 40 bills, with the fiscal notes we have submitted, we're looking at $25.8 million in the first year, $30.1 million in the second year, and $65.4 million in future biennia, without consideration for the increase on the OPEB liability if AB 188 was to pass. I know there's a lot of discussion around those individuals that were hired after 2012. This is not the first time that's come up. We know that it would be something that a lot of the employers have asked about, but we also have to keep in mind that although there's the assumption there is no cost, there is a cost. We are looking at increased administrative cost, increased claims cost. We really don't know when those individuals may come onto the plan. We're looking at 2027 at the earliest for the 15-year retirees, but keep in mind that if they had local government employment prior to coming to the state in 2012, that time counts, and they could be coming on the plan today for all intents and purposes, depending on their individual situations. So looking at that and not really knowing what that makeup of membership is, in addition to the staff that PEB would need to handle the customer service for the additional members, there is a cost. What that true cost is, we really don't know at this point in time. And with that, I will open it up for any questions.
Board members, are there any questions? Yes, Ms. Kelly?
Thank you. Michelle Kelly for the record. Executive Officer Glover, you mentioned the total, so for all of the bills that have been introduced, if they all passed, and I understand that likelihood of that is not high, but you did say, 64 million over the future bienniums. And I've been thinking this week as I looked at them all, does PEB have a kind of a tracking mechanism from at least the last few legislative sessions that actually lists the legislation that's passed that PEB had to follow, and then the kind of the estimated cost? Because I know that at least since I've been on the board, like I think that there's been in every session, there's been stuff added to insurance that we've had to cover. And of course, as we all know, the participant, our costs, well, the money allocated to us, I'm sorry, has not really gone up even to keep up with inflation, but we've also had these added benefits. And so I'm just wondering, how does that interaction happen at the legislature that, when we have to keep covering stuff, but we're not getting extra money, even though you're putting fiscal notes on them? I just wonder what kind of attention does that get from legislators?
So this is Celestina Glover for the record. So a few things have happened with some of the fiscal notes over the years. Sometimes PEB actually gets exempted from some of the provisions of the new legislation because of the cost that comes through in the fiscal notes. Other times, we may hear from the bill sponsor to ask us questions about why our fiscal note says what it says. And then, of course, we're always open to discussions with those bill sponsors to fully let them know what this means for the program. It's not that we're necessarily against adding those benefits, but if we're not funded, what they don't realize, and I picked this up a lot through the comments, and other people probably have too, that they don't understand why the member would have to pay more, or if it costs the program more, but it's cost shared. And some of them miss that. And then they may go back and do an amendment to maybe revise some of the provisions in that bill. We haven't done any formal tracking of past legislation to see what that has actually cost us. But it is something we can go back and look at. The fiscal notes we put in the past, did those bills go ahead and get passed? And if they did, what did it do? But generally, we just include whatever benefits are required by law and hope for the best, essentially, if we're not getting additional funding. And it does come out in higher rates, as you've said.
Thank you for that response. I think from a accountability standpoint, having a list of kind of newly mandated coverages and then kind of the cost might actually be a helpful tool, even for us talking to employees as well, because employees don't necessarily understand, because most employees don't use every covered aspect in our insurance, right? They're using pieces. And so they may not understand that, in the last few years, the PEB has, had mandated items that we've had to add to insurance that is actually costing. And as you say, none of us want benefits to be cut, but the reality is that that's why costs are going up, because costs are increasing generally, and then we're having to add new coverage, and it all has a cost. So I personally, I think it might be a useful tool for PEB going forward to kind of just track that kind of thing and put some dollars to it every legislative session, as I think it tells a good story. So thank you.
This is Celestina Glover for the record. We do track the legislation that was passed. It's just we haven't added the cost piece. Sometimes we don't realize that cost for a few years, or we realize a small portion of those costs as members learn what the new benefits are and have the need to take advantage of those benefits. So we can look at that, go back to previous sessions and see what was passed and get some information on the cost and put something together for a future board meeting.
Ms.
Thank you.
Rich?
Thank you. For the record, Laura Rich. Tina, I have a couple questions, actually 3 questions. For AB 169, the $3.3 million seems really, really high. Did you guys look into utilization, or maybe, I don't know if Siegel is on, but maybe if Siegel can discuss that fiscal note and how that, how PEB came up with that number, that just seems high. And then I guess the other 2 are not really questions, they're just comments on AB 22. I have to say that I do agree with it being in Executive Officer Glover's shoes prior to this. It's the contracting piece and being kind of the anomaly of the state process is very, very difficult on PEB because it just creates this extra step. And we don't really align with other state agencies. And so it becomes really difficult and is burdensome on the agency. So I do agree with that. And then also the other comment that I wanted to make was on AB 188, the retiree coverage. I think something that's important with retiree coverage is the state, you have to remember the state is one of the only employers that provides retiree coverage, especially when you're looking at other, the counties and the municipalities and even private sector employers. And while that's great, I think what's really recruiting and in making an impact is being able to recruit current employees, right? In looking at the current benefits for the active employees. That's what people really look at. And so when PEB has done this kind of look back in the past and done the comparison, states or other counties and other employers really focus their efforts and their resources and their funds to active employees and not so much to the retiree coverage. And that's where they're able to recruit and have better benefits for actives and really get a better recruitment from that. So, I mean, I just want to point that out, that you have to balance out, there's not unlimited resources. And so you have to balance out where you're directing prioritizing where you're directing your funding. And I think if the point is to convince people to come to work for the state, I think having better active employee benefits is really what's going to get the best bang for your buck.
This is Celestina Glover for the record. So to your answer about your question about AB 169, we did do some calculations. The 3.3 million, of course, is our worst case scenario. Right now, we allow up to 90 visits a year. The average cost in 2026 is expected to be $79.95 per visit. This bill would take that limit off. So the worst case scenario, if a member was to go every single day outside of holidays and weekends, that's potentially 250 visits at $80 a pop. That's where that number comes from. So we're looking at 5 million. So between the 1.8 we potentially could spend now and the 5.1 that we would spend if somebody was to have a visit every day, I can't imagine that would happen, but we have to consider it. So that's where that 3.3 is. That's the additional cost. And we took that out into future biennia. So that's how that number was devised. We also had information that what we pay for these types of visits are probably a little lower than some other states do. So our per visit cost is a little bit less, but if we increase it to where somebody potentially could have a visit, 250 days a year, it could get quite expensive quite quickly. So that's how we got there.
Okay, thank you. That just seems so, I know you're saying it's worst case scenario. It just seems so unrealistic that I think it seems like Siegel would be able to provide a realistic fiscal note, as to what that utilization would look like. It just seems like that just seems unrealistically high is what I'm saying.
Yes. And Celeste Glover, for the record, we did include that information in our spreadsheet that we attached to the fiscal note, that this was the potential increase, and we gave them the numbers if somebody was to need that visit. So
Yes, Miss Kelly.
Thank you. Michelle Kelly for the record. So I have some comments on SB. What are we doing? Now my notes are all AB 22, I'm sorry. So, I think probably everybody realizes I'm probably not in favor of this one. I am concerned that, that we need to do as a board, we have a fiduciary responsibility, and contracting is part of that responsibility. And it is in the NRS that, we're tasked with fiscally prudent, putting together a package. And I think contracting is a major part of that with PEB, right? We contract for everything. And of course, that is your frustration, Executive Officer Glover, is that we contract for everything. But obviously, it's a major part of our cost. One of the things, I think that we have a lot of changes coming. We're going to talk about the Nevada Health Authority, and I know I've thrown that out before, but I think that's a significant change coming down the pipe, however it works. Whether it's purely reporting structure or more, which is the presentation seems to make out that it may be more. So I think that, making changes piecemeal is, I'm not in favor of that. I also do wonder though, we are responsible for contracting, and the report that I think Ms. Whalen puts out for the board is helpful, that kind of outlines all the contracts we've got going and what the cost is. As I was listening to your explanation, Ms. Glover, it occurred to me that as a board, we've never actually seen, or since I've been on the board, we don't actually see the RFPs. I think that is a committee responsibility. The committee's formed and then they put together the RFP. And so, really the board doesn't even have oversight over what goes into, or even knowledge of what that contract is fully made up of. We kind of get the head item like TPA services, but what are TPA services? And so, my suggestion would be that the board actually does see that and approve the actual RFP. If we end up going down this route where the board is taken out of the line, at least we can see the RFP and understand exactly what we're contracting for. I think while I'm not in favor of it, I think I'd feel a bit better if at least we saw that the entire board had the opportunity to see. Obviously, you can't force us to read it, but at least the scope of work, I think, is the pertinent piece. So that might make me feel better. And then switching to AB 188, Ms. Rich made the comment that other, local and our recruiting competitors don't offer retiree health insurance anymore. I think that that's changing again. I think that, yes, retiree health insurance was one of kind of those low-hanging fruits to save money, but recently Washoe County has added retiree health insurance back into their toolkit. And I do think, I think it is worth PEB investigating, because on the ground at NSHE, we used to talk about retiree health insurance a lot, because yes, for young people, they don't care. But once you're starting to look to recruit professionals, top level professionals, it's those kinds of things that really make a difference to employees. And we want the best and the brightest. And so I think having retiree health insurance, a subsidized program, and at 15 years seems really reasonable. I think, anything below, we want career employees, right? We want people to stay for a long time. I do have a question, finally. So I noticed in the chart that you provided, you talked about there being, you estimated like 73 employees when this came online, if it passed and it came online. But you also said 4 employees. And so I'm just wondering, it kind of feels like a mismatch to me if we're starting out at around 73. And I would assume that, for every 50 added, 25 are also dropping off. So why obviously I agree PEB needs more staff, but 4 being attached to this particular fiscal note, I'm just wondering if you could talk about that.
Celestina Glover for the record. So the 4 staff that we're looking at, they would go into the various units in PEB. They're not all under, all under accounting or QC or whichever. They would be in MSU, eligibility, quality control. So we'd have 1 in each place and 1 in accounting to account for the additional workload. The 4 is for future biennia. It's not immediate. The 73 retirees, that is the number we believe would potentially come on in 2027 if they retired with 15 years, and we didn't see anybody with time from prior to 2012. So somebody who maybe worked for Washoe County and then came to the state. That number could be significantly higher. It could be lower. By the time we would be able to ask for staff, we would be looking at the 2027 session. And the likelihood is we wouldn't even begin recruiting and hiring for those staff until either fiscal year 28 or 29, depending on the timing of when they said we could bring staff on. So by the time that happened, we could have even more retirees coming on. And keep in mind, we get the retirees on. Those retirees, ideally, their positions would be backfilled with employees. We don't know how many dependents that will include because we don't know if they're going to be married with children or whatever. And with mortality rates the way they are, we have retirees that are long-lived on our plan. So we can't guarantee that if we bring 70 on that we, 10 go off because they pass away or they move into the exchange. Those people still need customer service from PEB, even if they're getting their plans through the exchange. So, we can't, I guess we could hire a part-time employee versus a full-time, but that is where we went, putting 1 person in each of the various work units to account for the additional workload that potentially comes. We're looking at as many as 1,000 new retirees on the plan, probably within a 10 to 12 year period. And if you go much beyond that, those new retirees, although we know we're going to lose people, but we're going to get more people in addition to that. So, it could be a 1-for-1, it could be 10 on and 1 off. We just don't know. So we're trying to be a little bit conservative there, not over state what we think we're going to need, but we also don't want to understate it because that will harm the plan. It harms our staff's ability to get their job done, and it doesn't help our members either because we're not providing the customer service we should be.
Any further questions or discussion on this item? Okay, it is listed for possible action. Do we have a motion?
This is Celestina. Looks like Janelle maybe had a question. I saw her hand.
Okay.
Sorry, I just wanted to, I guess, go on the record and agreeing with Michelle that I do think it is worth looking at a little bit further at AB 188 and the possibility of the retirement for those after 2012. I know that I work with several people who are in that situation and have voiced opinion about that, as well as also being told about Washoe County adding that back. So just putting that on the record. Thank you. And I was Janelle Woodward for the record.
Chair Grimmer, this is Celestina. So I just wanted to also add with the bills outside of the PEB bills, the AB 22 and SB 32, it has been the policy of the board and of the governor's office that state agencies do not testify either in opposition or in favor of any bills, that we testify in the neutral stance, and to make sure that we are clear in the information we provide. So I want that kept in mind when any action is taken on this, that please don't ask me to go oppose a bill, even if we oppose a bill, because I can't go there. So I just want that clear when any other discussion on these bills, where we would like to go with them, or if we'd like to do anything with them. Thank you.
Okay, thank you. Do we have a motion on this item?
Madam Chair, this is Radhika Kanal. On that note, just like what Mr. Tina just expressed,
Okay.
I am not sure, while it's agendized for a possible action, I'm not sure if any action is sought at this point. Maybe
Okay.
Ms. Glover can elaborate on that, but from the discussion and from the purpose of this agenda item, it is unclear if it is a possible action. Should the
Okay.
board decide to make it as a possible action, we may need to go through, please advise it so that I will go through the disclosures prior to the action.
This is Celestina Glover for the record. I think the only thing for me anyway was to have confirmation that the board's policy is to stay with testifying in neutral, and just get that on the record officially. Anything else the board wishes to do, that's up to them, obviously.
Okay. If there's no further discussion, I will close this item and we will move on to agenda item number 4, presentation and discussion regarding Nevada Health Authority. Stacy Weeks, administrator, and this is information and discussion.
Good morning. Thank you, Joy. CC Weeks for the record. Is it okay if I just share my screen? Is that how this might work? I'm just going to walk through some of the slides, and I have a few comments just based on some of the public comment. And I apologize, I'm a little under the weather today, so may have to, let me find my screens here. There it is. Okay, can everybody see that okay? All right, great. Before we get started, I just want to acknowledge the feedback and the comments. I totally appreciate that perspective and understand that this is a change, and there are a lot of questions about it. You know, there is a budget BDR coming out. I think that will help answer some of those questions. But I do want to just note that I think also as a former PEB board member and also as an administrator over running the agency for Medicaid today, public employee benefits and even the retiree benefits are critical to our state. We have to find ways to do better where we see that PEB needs support and more competition. We have to be thinking outside the box on that. And that is what the governor is trying to do here. You know, I think the capacity right now of our state and the PEB staff is limited. And a lot of the capacity that I have at Medicaid can help support them, in addition to the other agencies that are coming together. The goal is not to reduce or change current structure unless we find a better way to do it. And the board is still a critical partner in that role. So I just want to start off with saying that. And I recognize change is hard. Changes are often I mean, I feel the same way about change, but I do want it to be an open conversation. And if this is to pass, I want folks to understand that our perspective over at the division now is to have town halls and listening sessions and things of that nature. Nothing major is going to change. We're going to be doing modeling and coming back to the board on various options that might be available to make things better. So I just want to start out with that. This is just some of the background that we presented to lawmakers about what is going on in healthcare in Nevada beyond just Medicaid. We are, according to Kaiser Family Foundation, still one of the fastest growing states with healthcare costs, right? And I think we all feel it. I mean, we see it in the Medicaid program. I know PEB sees it. Our employees experience it, and so do our retirees, and so do Nevadans. We also have, costs that all of healthcare costs our state. When you combine just the number of covered lives from a state perspective, Nevada covers 1 in 3 Nevadans, either through the employee benefit program or through Medicaid, and then also the new public option program. So if you think of that, we are paying as a state, and taxpayers are paying for healthcare, and so are our employees. Things that aren't working, that are going down, that we need to work on together is that we continue to have a professional shortage area. I heard someone talk about Medicaid rates and provider networks. Totally appreciate that, but I just want to note that Medicaid is paying better than some of the markets that we hear this from providers. I just want to start there in some of our areas. The other thing is this is not applying Medicaid rates to these other networks. These are still separate programs and separate markets. It's about leveraging smart ideas and smart strategies to purchasing if these carriers are going to be operating in our state, and asking them to be fair in all of these markets across the board. This is not to apply the Medicaid program to any other market. It has different rules and requirements and is very complex, and I would not impose that on anyone because it is on its own a very complex program. We also have limited provider networks for our state employees. Carson Tahoe is a good example. I'm just going to say the elephant in the room. I sat on the PEB board and we talked about this. It was very challenging. Unfortunately, PEB is very limited in what they can do. So UMR and others hold the bag. And I'm just going to be honest, and so does Carson Tahoe. The state has very little leverage in this fight. And to figure out how do we complete that network. Having the health authority look at ways to do direct provider contracting may change that dynamic. And those are the kind of things that we're looking at. Having the capacity to do that and to give PEB that capacity is key. And so that's also something that I want to raise today. The other thing, and I don't know if all of you probably do know this, but it's something that we continue as state officials to hear at every presentation we go to or national event. We are in the bottom in the country on every healthcare outcome. And it is continually appalling. And I know we can all agree on that is something, as all of us that work in healthcare need to put our resources together to tackle. And then the other thing I think many of you know too is that PEB lacks competition. And without competition, you don't get a good deal. And we don't see that. And I think that is reality. We've seen it in the procurements. At Medicaid, we have tools and we know different strategies to do that and to improve competition in our market. And those are types of things we'd like to leverage and share together in the state. So this is just a visual of kind of what's coming together. So today, for those of you who may not know DHHS, which is our Department of Health and Human Services, it's a very large department. It the department plays many roles and many hats. It has a provider hat, has a payer hat, has a regulator hat. It also has, a direct service and eligibility hat. It has so many hats, and sometimes just even myself, when I go into the website, I know consumers feel the same way, coming to DHHS as an entity is challenging to navigate. So part of this is also trying to figure out what are those real main priorities and roles and responsibilities of this agency, and ensuring that they're actually managed in a way that's not siloed and that they're actually working together and that it's easy for consumers to access the services. So the health authority is really trying to drive out some of that payer and regulator side to give it the independence that it needs from the program and the services. And also on the bottom bubble there is really the new Department of Human Services, which would be really focused in on provider services that the state provides. So the state provides a lot of healthcare services. It also provides case management, child welfare, in the rural areas. It does a lot of service activity, and so that would be the home for those activities. It also will still include public health and some of our behavioral health and maternal health block grants. The exchange, which is SHIX, I have the acronym there, Silver State Health Insurance Exchange, that would come over into the health authority and be part of the larger effort to improve healthcare in the state, and PEB as well, becoming under that umbrella to be supported where it can with some of these efforts. These are the other items that the governor feels that should come under the new health authority that would be coming out of DHHS. Some of them you may be familiar with and some you may not, but I just wanted to bring those here to you today. The other nice thing that I think this new health authority will really bring together is the all payers claims database, and really gives us a look at all the markets. So right now we are kind of blind to the reality of what providers are getting in other markets. We only know what the state pays, right? And even then it's proprietary. Having some of these claims and database across the market can really give us a chance to look at whether or not providers are being treated fairly, what are the games going on in the market, and what can we do better as a state to really negotiate coverage for Nevadans. This is just an overview of proposed org chart. During session, you never know where things are going to land. So I'm just going to start, this is a starting point. The one thing that's going to be unique to this agency, which is similar to Washington and Oregon in sense of like having authority to purchase, is that this agency will have its own independent unit that's focused on the healthcare purchasing and looking at strategies to help each of the markets that are under this authority to be more competitive and clear to and more transparent to Nevadans. It also will have its own regulatory council and a Medicaid inspector general, as well as our healthcare quality unit, which oversees our facility licensure and fraud, waste, and abuse. And then there'll be the budgeting unit. I just want to note that PEB as a whole stays the same. It's really allowing them to be part of the bigger effort at the state level to really improve things on healthcare, including provider networks, quality, costs, all those things. So we are working together on those efforts and leveraging the resources that we have. We also have pharmacists on our team. We have a pharmacist, we have a physician, we also have a dentist, and we also are building our pharmacy team because one of the things that we are proposing in the budget and a lot of lawmakers are proposing is moving to different purchasing strategies for pharmacy. For example, one is the single PBM. We want to do some modeling around that. We first want to start with Medicaid. We do think there's significant savings there for the state if we do that right. PEB could also benefit from that over time if we think it is going to work for them. Obviously, anything we would do has to go through the board. Those things do not change under statute. So I just want to explain that piece of it. Nevada Medicaid would remain primarily the same too. Some of the budget pieces are moving out so that the individual over Nevada Medicaid can focus on the program, the recipients, and access. Consumer health and access is where our state exchange will live. And same with our new Medicaid Express, where individuals can go through the exchange and shop for coverage and compare plans. And then obviously GME, our graduate medical education, this entity will be over a lot of the workforce efforts where we're trying to maximize federal and state and local dollars to really improve access to training and physicians and other providers in our state. And as you can see, there's Office of Analytics, which can also benefit PEB as well. I think someone referred to this slide in public comment, so I just want to clarify a couple things here. The goal here is to really, because often we're all working, and this is just reality of state government, and I know everyone wishes it was different, and it's not purposeful. It's just that we are doing our day-to-day, and we are all working on issues in quality, costs that are affecting all of our programs in some form or fashion, the healthcare system costs, and networks. That is a constant battle for all of us. We have stronger network adequacy requirements in Medicaid than PEB. There are things that I think that could be different in PEB if we are aligning some of our efforts and looking at how do we do that without affecting providers or lowering benefits. How do we do that in a way that's most beneficial? So coming together as a group and really looking at data together and coming up with a strategic plan together is the goal. And then also just having sort of that regulator side as well. So we can understand in the system, we do have bad actors. There is provider fraud. We just had a hearing recently about some of the issues with Medicaid, and there is provider fraud. That is reality in all markets. And there's also the healthcare quality and licensure piece, having those all together to really ensure that we've got the best providers in our state, that they are licensed and doing the things that we have asked them to do, and we're billing for that appropriately is really the goal here. And then also just supporting providers. Some of the good actors who want to come in our state, we often hear that they go to multiple venues to figure out how to actually participate and bill. And so having one, stop shop for providers and ensuring it is streamlined and that we're listening to figure out how to remove barriers is also the goal of this effort. I won't read through each of these, but I think a big piece too, and just the department that we're currently housed in, there is that provider system and regulator system that we're trying to remove that. There's a conflict when sometimes you're the provider and you're regulating yourself. So that's part of the goal here in removing that. It's, to ensure there is that no bias and no conflict in the system there. There are opportunities to leverage federal resources, not just grants, but also Medicaid dollars. We do get match on our staff. And, I know people are talking about the Medicaid changes, and yes, those would be impactful to our state, but no one is saying that all of Medicaid would be gone. We would still be getting some of the match for our staff, and there are opportunities for us to match together when we're doing things that are improving Medicaid, including network. Combined payers, I mentioned this already. There are strategies when we do procurement as one agency for multiple markets that can leverage competition that we don't currently have in this state. And so that is one of the goals. And obviously, any of our strategies would have to go through the board as if we do today. Leverages Medicaid healthcare purchasing. I mentioned this earlier. PEB would have access to our pharmacy team, some of the actuaries and vendors that we have that are looking at new models to control cost, but also improving access. It can't just be, we want to control cost, but there are no benefits. People need the benefits. So how do we do that? We have a lot of really great expertise on our team that we would love to be able to share and to work together as one agency or one entity, I guess you can put it that way, because everyone's kind of their own still little agencies. The other opportunity here is to align where it makes sense, some of the actuarial resources and other vendors that we're using that are duplicative. Not too long ago, we were talking about electronic health records and all the different agencies that have a vendor or want a vendor to do that work. We should be having one contract for the agency to do this work. So we're looking at opportunities to really streamline and save money, but also save money in a way that really, improves capacity across the agency. Also looking at data and resources to better look at population health. One thing I think we know is that each of the markets have different outcomes, and we should be looking at and comparing that data and thinking about, as a state, how do we better manage population health? How do we get people to the lower cost, most effective resources, including primary care? Right now, that is not always the case because of access issues, but we don't have that look or data, and we're not looking at it as a whole to really be able to have those discussions about what kind of activities we want our health plans to be doing to address these issues. And we do that some in Medicaid, but if we were able to really work with our plans and providers, for example, to tackle maternal health issues across the state, across markets, we'd have a much better impact on outcomes. Just real quick, next steps, budget hearings and account changes, all those things are ongoing at the legislature. I know Celestina already talked about some of the timelines, but we are just waiting on a budget BDR to be dropped by LCB. Hopefully we'll get to review it and never know if it's going to look exactly like what we think it is. So obviously, if you have concerns or questions, I think feel free to reach out. We want to get this right, and we want the board to still feel like they have a role and their voice in this, and that they do today. And like I mentioned, the PEB board is maintained. There are term limits. The governor's office is, looking at different boards and ensuring that there is fair representation and some people moving on and off the boards to ensure we have fresh voices at the table. So that is new, but it also applies to other boards in the state as well. I'm happy to talk about those and obviously open to discussing any amendments that might be needed. The PEB board in the new work will not be the actual hire of the director, but they will be doing the interviewing like they do today and making recommendations to the director and the governor for the final hire. So there's more shared responsibility in that position with the governor and the board. There are changes in the PEB BDRs right now to align with the policy BDRs, but after these discussions today, depending on where things go with legislators, those things can change. And then it also allows PEB to leverage the vendors and resources of the health authority with the board's approval to save and streamline efforts. And then there is funding for a report that the new entity will be working on together across all of these agencies to put together a purchasing strategy for healthcare that would come to this board as well as legislature to talk about what might be needed to improve or change the healthcare program today. So nothing will be happening unless the board obviously approves. And if there are statutes that need to be changed, we would have to go through all of those processes. But that would be something we would want to bring to the board first. And then also, like I mentioned, this is definitely going to be session as you never know where things land. So things as they change, I'm sure Celestina will be keeping you updated, but I'm happy to answer questions or to meet with folks offline if that's helpful. And I'll stop there if folks have questions. Thank you.
Okay, board members, are there any questions? Yes, Ms. Kelly?
Sorry, Chair Grimmer, I have to ask. You know it. Thank you, Ms. Weeks, for the presentation. Very interesting and, potentially exciting, but also scary, right? I guess in my world at the moment, I've taken a lot of questions from participants because I manage a retirement plan just about confidentiality of information in my silo. So putting on my employee hat and coming to you with the merger of these departments in order to leverage all of the kind of things that you've talked about. You're talking about, I guess, aggregating data from PEB, claims data, individual data, family data. What kind of protections and security is there for data if the state takes it in between Nevada and federal? So what, I think right now I understand HIPAA. I just redid my HIPAA. I know that there's those protections, but I just wonder with the health authority wanting to leverage all of what PEB has, how is that security going to be maintained, and how is Nevada going to ensure that employee data itself and its family and health conditions is kept confidential from everybody?
Stacey Weeks for the record. Michelle Kelly, there's nothing that's going to change that's currently happening today. The claims database that I'm talking about, APCD, PEB, if they're supposed to be reporting to it, they will be reporting to it. We would not be taking any data or accessing anything outside of HIPAA privacy laws. There's nothing there that wouldn't be changed, that wouldn't happen the way it is today. What can be different here is that we're looking at data together that is available today in a way that we can do population health management and come to the board and be like, look, we're looking at these outcomes in Medicaid, and then we're seeing it different in PEB. Why? Having those conversations as a state. No one is taking anybody's claims data. So I don't want to fear, I don't want any fear mongering coming out of this a little bit here. So the data piece is definitely protected like it is today. It's just allowing us as an entity to look at it together to think about ways to improve outcomes. So where PEB and Medicaid and the exchange see similar outcomes or issues, they can work together on those issues.
Okay, thank you. I mean, I didn't mean to fearmonger, but it's a legitimate question that our employees ask all the time about the security of their data. So I apologize if you thought I was fearmongering. And then on slide 7, bullet point 4, you talk about simplifying access and streamlined messaging and marketing as being kind of one of the things that come out of this. But at the same time, you're talking about PEB remaining the same. So I'm just wondering, that's a little bit of a conflict to me. So for, what is the streamlined messaging and the access? Can you kind of talk about that particular bullet point?
Yeah, no, that's a fair question, Michelle. Stacey Weeks for the record. What we're talking about is generally around messaging around coverage, right? And ensuring that people know how to access their coverage, whether they're employees or if they're having challenges, that they experience a similar customer service. If it's coming from PEB or Medicaid or the exchange, that there's a similar way that they all know where to go to find it. We could be doing messaging on open enrollment periods. We could be doing messaging around when we do things around diabetes. It's like all the things that we can do as a state that we're doing in PEB, we should be doing them market wide. So that is the goal, to really streamline that messaging. There's also marketing sometimes around different opportunities for, obviously with employees, we could be doing that differently and leveraging some of the more sophisticated marketing that the exchange does and looking at what they've done that's worked that we could use at PEB. So those are the opportunities that we're trying to bring forward and figure out a better way to communicate to people. Because right now it is confusing. I don't know how many employees I have come to my office complaining about they don't know how to access something. So I think, how do we how do we look at all these issues across all of our programs and maybe come up with a solidified solution, or at least make sure that the experience that Medicaid members are having, PEB employees should be having better or the same, right? Right now, I wouldn't say that's the case. And I think it's a lot of times it's capacity and also just not looking at strategies that are working in some markets better than others.
Okay, any other questions? Ms. Rich?
Laura Rich for the record. I just want to say that I agree that this is a big change and change is scary. But we also have to realize that cost keeps increasing, and really keeping the status quo is not going to change that, right? Like we're not going to be able to impact the cost of healthcare in the state, and we're going to have to constantly be reacting instead of being proactive. And I think this is an idea that's exciting because it seems like a proactive approach to a problem, and I feel like it presents more opportunities than risks. I also feel like PEB has always been kind of in an island by itself, just kind of the way it's set up. And so bringing this in under a health authority really, I think, would help the agency. It gives it access to resources. It, gives it access that it doesn't have today, and also support, because I'm sure that Ms. Glover can, attest to this. Sometimes you're just out there and, you're alone. You don't have anyone to fall back on. And so I think this is a great opportunity and a good move overall.
Any other questions? Okay, seeing none, we will close this agenda item and move on to, whoop.
Hold up one second. This is Celestina Glover. Looks like board member Karsten maybe had a question. I saw her hand pop up.
Thank you. Am I okay? Mrs. Weeks, my question was, I heard you say that there would be an opportunity for exploring different models, and then those models would be presented to the board for review. So it's not like these changes or action would be taken without participation from board members, correct?
Stacy Weeks for the record, yes, that is correct. We would be working with actuaries and national experts to come up with different options for the board to consider to see if there are better ways that we could get better benefits and coverage for both our retirees and our employees.
Okay, thank you.
Okay, any further questions? Okay, seeing none, I will we'll close this agenda item and move on to agenda item number 5, public comment. Public comment will be taken during this agenda item. Comments may be limited to 3 minutes per person at the discretion of the chairperson. Persons making public comment need to state and spell their name for the record at the beginning of their testimony. Do we have anyone for public comment?
Madam Chair, we do not have anyone in the public comment lobby. Do you want me to leave the slide up for a minute and read my announcement to give someone the chance?
Sure.
Awesome, thank you. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you will be advised that you have been unmuted. Please slowly state and spell your name for the record and then proceed with your comments. As a reminder for those on the phone, please press *6 to unmute.
Okay, seeing no public comment, we will close this agenda item and we will adjourn.
Thank you.
Thank you.
You.